You're listening to the City of Abilene's podcast, Building Community Together.
Hi, everyone. Mari Cockrell here, Communications and Marketing Director for the City of Abilene. And thank you for being with us. We are talking with Annette Lerma. She is the Director of Public Health here for the City of Abilene. How are you, Annette?
I am wonderful.
Oh, exciting. Glad to have you here. And, we've kind of curated a little bit of a batch of seasonal weather, holiday kind of related topics to talk to folks about it as far as what city services going on. And so public health comes to mind for a number of reasons, but in particular, you guys have something cool and new going on that I want to talk to you about that it's fascinating. Honestly, I feel like you're fascinated by it as well.
Do I give it away in director's meeting when I get really excited about talking about the poop report?
It's the highlight of director's meeting for me. So what I guess the thing itself is not new at all, but what is new is what we all affectionately refer to as the poop report, because public health is now able to track. I mean, I don't want to say track our poop, but learn, work with wastewater and learn a lot about the health trends for our community as a whole. So tell us all about what the poop report is.
Well, so it is it's a partnership between our city wastewater department or water utilities department. And through the Texas Department of State Health Services, along with Baylor. And so the wastewater team collects the samples and they send them out to the group at Baylor. And they analyze them, and then they send that report back to us. And our data analyst takes all of that information, and she puts together this really cool wastewater surveillance report and is creating a dashboard. So we get to monitor. What's interesting is during COVID, we had a lot of medical providers reporting to us COVID cases. Well, now that's no longer required. And so this is a really cool way to monitor not only COVID in our community, but other viruses. And so that it's been a lot of fun.
Okay, I'm so glad we're having this conversation right now, because up until 10 seconds ago, I thought there was a very fortunate soul in your department who got to go out to Hamby Wastewater and collect the sample. So I'm glad the professionals out there are able to collect and send off, and then have a lab do that stuff for.
Yeah, so we actually went out there one time to witness the state coming in to install the auto sampler. So it's actually an automated, it's a sampler that pulls the water up, but the staff does go out and actually collect the sample from that auto sampler. So yeah, it's not quite as dirty as you would think.
And let's take a moment to shout out to everyone at Hamby Wastewater Treatment Facility north of town.
They're awesome.
Oh, and I'm just always fascinated that all of our waste, whatever you put down a toilet or a drain or whatever, it has to go somewhere, and it all goes to one place.
Yes. And there are lots of non-water things out there that they collect, and it's just eye-opening to see everything laying down at the bottom of that ditch. Like, why are people putting this in the toilet?
I know. I didn't fully grasp that until working in the city and saying, like, oh, okay, I gotcha. If you put there's not like a separate drain for separate, it all goes to one thing.
Nope.
But we'll get with Hamby for an exclusive podcast episode on that. So the poop report though, so you're able to see so much. So just tell us a little bit of why this information is so much more valuable to really get this look versus maybe the reporting from clinics and things like that, and what you guys are seeing, what's been sort of fun for you guys to see.
Yeah, it's been interesting because, we continue to monitor COVID, for example. We monitor, I think there are 5 different viruses that we're currently monitoring. But with COVID, for example, we still get some of the clinics who have voluntarily been reporting to us so that we can continue to monitor what's going on in the community. So you have that report that we get by reported cases. And so we'll see kind of a trend upwards, and it may be that the trend week over week might have had a 75% increase. And then you look at the wastewater report from that same time period, and you've got a 250% increase. And so it kind of is just, it's a better snapshot of what's actually going on, because it's not filtered. It's basically, the majority of the community going to that one wastewater facility. And so it's a much better snapshot. Even though getting those individual cases is helpful, it does help us to monitor those trends, but it's so much more accurate in the wastewater.
Yeah.
So we're monitoring the COVID, influenza, RSV, norovirus, and Mpox.
Got it. And even, I'm thinking of just COVID. I've never tested positive, but I'm also not really someone who tests themselves. So I may have had COVID at some time and not known, but you're able to see, how that might be affecting more vulnerable populations out there that do need to worry more about that. So, and how does this sort of, and this is a little piece just to really educate folks on what public health does versus what they might think you all do. But so getting that information, what are you able to do with it? And how does that guide your day-to-day work?
So what we do is it not only goes to our data analyst who kind of processes the information and puts the information up on this dashboard so we can track it week over week, but our epidemiologist also puts it in her report, and she sends out a weekly report to local medical providers, and it just kind of gives them a heads up, hey, this is really trending upwards, be on the lookout for that. And so it's kind of informing the medical community so that when you as a patient go into your doctor with some symptoms, they can couple that with, I saw that norovirus is really up and you seem to have some of those symptoms. And so it kind of, helps in that way.
Yeah.
And then we try to do anything where we see it's trending upwards. We're always going to try to do public education. We educate our own providers internally about what to be on the lookout for and things like that.
Yeah. It's just fantastic. I love it.
Great.
And I think we're working on too that folks may be able to see on our website soon as this dashboard comes together, what this looks like, this information.
Yeah, so we hope to be able to launch that this week. I think, I can't remember. I think we've been collecting data since January, if I'm not mistaken. And so we wanted to try to get at least several months or, close to a year of information so that people can see, does it trend up during certain seasons, which something like RSV, flu would be very seasonal. And so we hope that year over year, citizens will have a place to go where they can look and see, is this normal for us? It's great to monitor trends that are statewide, but it's always so much more helpful to know what's going on in your own community. So we hope that this will be a resource that people will go to just kind of learn, what should I be on the lookout for? Yeah. What should I be doing?
Yeah, I think in the last month, maybe, I want to say at Directors, you shared a little bit about norovirus having an uptick. And then I was like, oh, okay, interesting. But sure enough, my kiddos, others, like got hit with a little bit of a stomach thing, a little, it was kind of this faint. It didn't really require medication, anything major. But I was like, oh, I bet you that's this norovirus.
Yeah.
We went its way around.
Yep.
There you go. Well, and here as we head into winter months, we all are kind of course, on the lookout for flu and just in general. First of all, maybe you can really set this record straight. The cold does not make you don't get sick from cold, do you? Is it true that you're getting sick because in this time of year?
Oh man, that's a hard one because it depends on who you ask.
All right, that's a controversial.
I don't want to blow grandma's
but
her argument out of the water.
Yeah, right.
It could, Larry. I mean, getting too hot or too cold when you maybe don't have a good immune system, it could affect your health. But yeah, I don't.
But overall, we are definitely in closer quarters, and if anything, that's leading to germ spreading.
Yes. Yes. Those are the things we'll worry about. You listen to your grandma about whether you should put your coat on or not.
Yeah, right. Or at least put it on around her.
That's right.
When she's getting you. And so, but just with that said, as we head here into our colder months approaching, what are some of those education points y'all like to remind folks of to stay healthy?
Well, the biggest one for me is always wash your hands. And I know I say this every year. If you do nothing else during cold and flu season, wash your hands. So I've just gotten into the habit when I get home from anything, work, grocery store, whatever, I always go straight in and wash my hands because when you're pushing that cart around, you don't know who's been pushing it. And so I always do that first thing. Um, but yeah, just washing your hands, and not only when you get home, but throughout the day. Obviously, if you shake hands with someone, if you are around touching surfaces and things like that, it's really important to wash your hands. I know that there was a study done, and I'm not going to remember the exact study, but it was done in a school. And all they asked the teachers at that school to do was to set aside a couple of times every day to have the kids wash their hands. And they compared the rate of infections with flu, but with other schools, and they prevented so much flu just by doing that one thing. And so it is very important. Make sure they're washing their hands thoroughly long enough where you're not just putting soap on and running water over it, but for a good 20 seconds at least to get those germs off. So that really is the number one. I think what was really highlighted during COVID was just trying to be healthy, starting from a state of health, keeps your body ready to fight off anything that it encounters. So things like eating healthy, eating right, staying hydrated, drinking plenty of water, getting plenty of sleep so that your body can use its own defenses to fight off anything that you might be exposed to. All the things that we know to do, getting exercise, those are important things to staying healthy also.
Okay.
And then another thing that I think people should consider is taking a vitamin D supplement. We don't have as much outside time. We don't have as much sun exposure. That natural vitamin D is really good for boosting our immune system and good for bone health and all those things. But when you are not outside and you're not getting adequate vitamin D, some people are really susceptible to being low in vitamin D. So considering even taking a vitamin D supplement could be really key to staying healthy.
Okay. I feel like I'm hearing all these vitamin needs, and part of it comes with where I am in life as I'm in the 40s.
Yeah.
Like, I need someone just to give me a big old list. Like, tell me what you get with.
I used to make fun of my parents for having they had literally a plate full of vitamins. Yes. It looked like dinner, and it was just their vitamins. And as I get older, I find myself with my plate of vitamins.
Oh gosh, give me 10 minutes to take out my vitamins before I get to bed here. So attractive. Wonderful. Oh, but it's good. Like you said, it's true. Just being out in the sun and that is something our body needs.
Yeah. I think another thing that's really important is your mental health. Just, as the weather gets more overcast and the days are shorter, I think people are really susceptible to getting kind of those winter blues.
Yeah.
So learning to stay connected and reaching out to people. Our mental health can impact our physical health as well. So, when you feel yourself getting those blues, and that's very normal. Mm-hmm. Everybody goes through that, even people who are well connected and have lots of social connections and do those things. I think it's very normal for people to have those kind of ups and downs in their moods. And so it's nothing to be ashamed of.
Right.
And definitely learning to recognize that and knowing that, hey, I need to reach out and invite a friend to lunch or whatever to just stay connected with other people and, people that you can trust.
Yeah. It's a stressful year.
Yeah.
Providing for your family, whether it be presents or bills. Mm-hmm. Oh my gosh.
Mm-hmm.
It's wonderful. It's the wonderful time of year.
Yes.
But definitely give yourself grace and realize and maybe prepare for the support you might need if it is from talking with a therapist or someone, and maybe it's a great New Year's resolution to.
Absolutely. And in turn, ask other people if they're okay. Mm-hmm. Hey, you seem a little different. Are you okay?
Yeah.
Just making that normal.
Okay. Are you okay?
I'm okay today. Yeah.
Good. I know. Ask me
Today,
later.
right now, I'm great.
Good. Well, awesome. And if you're ever worried, just check out that poop report, and
That's right.
it'll always bring new knowledge and information. Well,
It brings great joy to me.
good. May everyone find their poop report and have the joy in life.
I love it.
Yeah, it is.
Sounds like a
It's
coffee
really
mug.
cool. Well, thank you to your folks who are doing that, and our virtual shout out again to Hamby folks for what they do.
Yes.
And awesome. All right, here we go. Holidays, we got it. It's gonna be great.
It'll be great.
Thank you so much, Jeanette. And we will be on the lookout there on our website, abilenetx.gov. Should have that dashboard coming online here, like Annette said, very soon, within the week here. We're here recording here in early November. So here by mid-month, you should certainly see something up and get a look at what that looks like. So thank you for being with us. And as always, get your latest information by following us on the socials or just go to abilenetx.gov.